The observations are quite recent, as you know. The largest number of cases so far recognized appear to be in New York City, New York State, where they're approaching 90 cases. It is an association which has been described now in several regions of the world, but I emphasize the term association. That is, the cause and effect relationship between the coronavirus infection and the occurrence of Kawasaki's is increasingly seems to be evident given the number of cases, but the mechanism of the disease is really unknown at this point. Kawasaki's disease has been around since the mid-1960s when it was originally described in Japan, and it's been a disease which has always been a mystery in terms of what precipitates it, and it's gone through a series of accusations against different pathogens and different stimuli. So this is one in that series. But the fact that these cases are occurring in clusters at the same time as COVID, of course, makes the association tempting and therefore worrisome in terms of its relationship to the COVID pandemic.
Since you touched upon rushed vaccines and rushed treatments in this sort of a desperate environment, what do you make of how we should be approaching this whole situation where, you know, the efficacy of such a vaccine may be put under question?
Well, the efficacy at the point the vaccine becomes widely available should not be put under question. The trials that lead up to the demonstration of efficacy should be appropriately statistically powered, which they will be, and appropriately conducted in a randomized fashion, which they will be. All vaccines and all biologics go through several phases of testing. The first phase of testing, phase 1, is simply to determine if the vaccine or the drug has safety in humans. After it's emerged from the laboratory from animal studies, that is just to demonstrate that it is a tolerable agent. Then the next phases, phases 2 and 3, are to demonstrate that the vaccine or the drug is effective in the endpoint that you are seeking. For a prevention strategy, such as a vaccine, of course, you are seeking the endpoint of a reduction ultimately in a reduction in the number of infections. A proximal endpoint to that, an endpoint before that with vaccines, is after safety is demonstrated, to demonstrate that when you give it to an individual, they mount an immunologic response, which is very similar to the immunologic response of a natural infection. With that, you assume in the short term that it will be effective in preventing the disease, but the ultimate test of a vaccine is demonstrating substantially, statistically significant reduction in infections in the vaccine recipients versus the non-vaccine recipients. And a vaccine will not be released without the demonstration of first the safety, second the immunologic response, and third the prevention of infection.